All right, good afternoon, everyone. My name is Sam Holst. I'm a veterinarian with Swine Vet Center in St. Peter, Minnesota. Richard gave us a great overview of kind of the history of VFDs and some of the mechanics and functionality of how they're going to change. What I'll be going over is how those changes are going to affect producers on farm and what producers can do to get ready for those changes so that we're all ready to roll by January 1st. And so this is our group up at Swine Vet Center. The slide deck that we'll go through is a collaboration of everyone on our team. And then also like to recognize everyone with the AASV, the National Pork Board, the National Pork Producers Council that's really done a good job of digging in and looking for clarification for answers that we've had to some of our questions revolving these changes. And so when we boil it all down, what are the main changes to antibiotic usage? And it comes down to two main points. And so one, as Richard mentioned, so our growth promotion claims, so our increased average daily gain and our improved feed efficiency claims, for those antibiotics that the FDA has considered medically important to human health, those claims will be going away for those products. And the second point is that, so for the products that remain for therapeutic uses, so our prevention, our control, and our treatment type uses, there will be increased veterinary oversight for those types of products. And so that'll be carried out twofold. So one, those medically important products that are delivered through the feed will require a veterinary feed directive. Additionally, those medically important antibiotics that are administered via the drinking water will require a veterinary prescription. And so Richard talked about the ones that were on the list. So these are the ones that the FDA has considered not medically important to human health. And so the ones on this list will remain available for their growth promotion type uses and will also be available over the counter. And so we've got BMD, Mecadox, Schisis, Flavomycin, and Denagard. And so I've asterisked bacitracin and Denagard. And so those are currently considered medically important to humans by the World Health Organization. So at this point, FDA does not consider them medically important, but we'll watch to see if maybe they get bumped over to the other side of the list at some point. And so when we talk about increased veterinary involvement in those treatment decisions, basically what it means is that producers that want to utilize either feed medications that will require a VFD or prescription products that will be administered via injection or through the drinking water will require a veterinary prescription. And producers will need to work with licensed veterinarian in their state in order to obtain those products to use for treatment in their sites and in their systems. And so when we talk about the relationship between veterinarians, producers, and the pigs, this veterinary client-patient relationship, or VCPR, kind of lays the groundwork for some requirements that we have to make in order to make that relationship official in order for a veterinarian to prescribe VFDs or prescription products. And so each state has their own little nuances on what a VCPR means, but in general, it involves these 3 points. And so one is that the veterinarian assumes responsibility for making the treatment decisions within the producer's herd. Secondly is that the veterinarian has sufficient knowledge of the keeping and the care of the pigs, and that's done by medically important and timely visits to sites within the producer's system. And finally, that the veterinarian, is available to provide any follow-up care or treatment. And so, as I mentioned, so those VCPRs might vary those specific requirements by what state you're located in, but just in general, this is what the veterinary oversight might look like going forward. And so it's going to be a combination of visits and additional components to prove that sufficient knowledge. So with veterinary visits, currently VFDs and depending on the state, prescriptions will have a maximum of a 6-month expiration. And so it'll depend a little bit on your state, but what it might look like is a veterinarian may need to visit a site or sites within your system every 6 months. And so in addition to those visits, there'll be components like necropsies and diagnostic testing to monitor specific disease challenges in a producer's herd, and then develop treatment protocols to put in place to specifically treat and prevent or control those disease challenges. A lot of times veterinarians also have access to production records, and so they can help monitor mortality and health throughout a producer's system. And finally, interaction with producers or service team members, service managers within a company or a system, so veterinarians can kind of get a report of what's going on within the system when they're not on farm. And so Richard talked a lot about the veterinary feed directive. I just want to emphasize a few points. And so one is that it has to be a written statement. Like Richard mentioned, we can't pick up the phone and call these into the feed mill. So it's either got to be generated electronically and then distributed to the producer in the feed mill, or a hard copy that's faxed or emailed. And the other point on this slide is that any extra label use of feed medications is illegal. And so it's important that when we're using these products that we're following the explicit label directions when it comes to the bacteria that we're treating, and also the duration of usage for those products. Additionally, all parties involved, so the vet, producer, and the feed mill, will need to retain those copies of the veterinary feed directive for a 2-year period following after they've been issued. And probably one of the biggest changes to how the function will be, so previously veterinarians could only write a VFD for a specific group of pigs on one particular site. However, now the FDA has changed that, so as long as a group of sites are fed out of the same mill and retain the same ownership, a veterinarian can list those multiple sites on one VFD. And so we talked about issuing those VFDs. I think electronic VFDs through companies such as Global VetLink, where they provide an online platform for veterinarians to populate VFDs and then issue them electronically via email to producers and clients. The other way would be a veterinarian could do them in-house, filling out a hard copy and then signing it and then scanning that and faxing and emailing to the producer or the feed mill. So those would be the two ways that VFDs are distributed. And so this next section is kind of some frequently asked questions that have come up from producers and others within the swine industry of kind of how are we going to get these changes implemented on farm? And so one, so is every group of pigs going to need its own VFD? And is my veterinarian going to have to visit every site that I have in order to issue a VFD? And so that answer is not necessarily. And so, for example, if we have one producer who has one flow of pigs over 12 sites downstream, but all 12 of those sites are fed out of the same feed mill. And so with those changes to the VFD, if we retain those sites have the same ownership and are fed out of the same mill, legally a veterinarian can list all of those sites on one VFD. And so in this situation, one feed mill feeding all those sites, and if that producer has 4 diets that contain VFD antibiotics, that would be a total of 4 VFDs for that producer. So in this, we've got our sow farm, our 2,000 sow flow. That's pigs are coming from the same flow. They're commingled downstream in either nurseries or wean to finish barns. And so they have a common health status throughout those sites. And so we may implement a common feed medication program for those sites. And so in this situation, we've got our 4 medicated diets. So a VFD for each diet, and then the sites listed underneath each VFD. And so when we get into bigger producers or bigger companies and things like that, there's more complexity. And so in this situation, we'd have one producer. However, this time there's 3 flows of pigs that feed 30 downstream sites. However, those 30 sites are fed from 3 different feed mills. And so whenever we have a different feed mill involved, those sites have to be on a separate VFD. So in this situation, let's say we've still got our 4 VFD medicated diets. However, since each feed mill needs a copy, so that's 4 VFDs for each going to each feed mill, so a total of 12 VFDs in that situation. And so we've got our 3 separate flows that are feeding pigs downstream with their corresponding feed medication programs. And so when we talked about veterinary visits, what this might look like, and it'll be potentially different by the state, and how comfortable your veterinarian is with fulfilling that sufficient knowledge, but it might, in this situation, for example, it might not be a visit to all 30 sites every 6 months. So especially if we're have pigs that are coming from the same flow, the same group of sow farms, so we have a similar health status throughout those downstream sites. Veterinarian, we might be able to visit a handful of those sites and be able to feel confident that those sites within that particular flow are representative of the health status and health challenges seen throughout that flow. And so it might be a visit to a certain number of those sites within a flow. So next, we talked about establishing that sufficient knowledge, and so can producers snap a photo or send a video of the pigs to a veterinarian to establish that. And unfortunately at this time we cannot use those technologies because of those VCPRs do have the requirement that a visit is needed to establish and maintain that VCPR. So next, let's say a producer has 4 days worth of VFD medicated feed in the bin. However, their VFD expires tomorrow. Can they still feed that feed? And so anytime we're feeding VFD feed, we need to have an active legal VFD in place. So in this situation, in order to continue feeding that, we would need to have a new VFD issued. And so part of the solution to mitigate, becoming under the gun, with expiration dates and things like that is, continually work with your veterinarian, ensure that we have those requirements to maintain and meet that VCPR in place. And if those are in place, then we should have little to no delay in being able to reissue that VFD. So next, you get a call, Doc, my pigs are sick. Am I going to have to delay treatment of those pigs until we can get a VFD issued and feed delivered? And so in those situations, again, if we have those requirements for the VCPR in place, there should be little to no delay in getting water medication treatment if that is deemed necessary by the veterinarian in place. And so that can be a good choice until we can get feed delivered. And so in those situations, talk through the problem with your veterinarian, develop a treatment plan, whether that consists of water medications or if the decision is made that a VFD medicated feed will need to be administered as well. And so producers might ask, so am I going to be responsible for having to remember when my VCPRs or my VFDs are going to expire? And so in that case, it's really a shared responsibility between both the producer and the veterinarian. And so in order to help remember those and not have to keep track of them on a calendar, so the electronic VFD companies such as Global VetLink are working on developing an auto-generated reminder that will deliver a reminder to the producer and the veterinarian when those VFDs are going to be becoming expired. Additionally, Global VetLink has partnered with MetaFarms for those producers that utilize MetaFarms for their grow-finish production records. I believe MetaFarms is also working on developing those similar type reminders. And so whenever we have new regulations, it always comes up, so what kind of records are the producer going to have to keep? So in this situation, as we mentioned, so all parties involved are going to have to retain that VFD for a 2-year period. And so the FDA has some specific regulations regarding electronic signatures and electronic record keeping. And so I believe at this point, many of those computers that are going to be on feed mills and going to be on farm probably won't meet those requirements. So at this point, it's looking like those will probably need to be printed off and filed and stored for 2 years. And this is nothing new, just a general reminder. Treatment records have been part of the PQA Plus program for some years now. And so just a reminder that when we are medicating pigs, no matter what the route, to keep thorough and accurate records of those particular treatments. So the next two questions kind of relate to those producers that manufacture feed on farm themselves. And so in this case, so a producer conducts on-farm mixing of medicated feed. Do they need a medicated feed mill license? And so in that situation, it depends on the category and the type of medicated article that is being used to manufacture the complete feed. And so I'm not a nutritionist, so we'll try not to overstep my bounds here. But so when we talk about medicated feeds, there's two categories, and so there's category 1 products, and those are products that don't require withdrawal. And then there's Category 2 products that require withdrawal or are VFD products. And so there's going to be a lot of those products that are transitioning over to become VFD products. So it's not going to be automatic that those will automatically become Category 2 products. That'll be dependent upon the product. And so underneath each of those categories, we have 3 types. So type A is our highly concentrated medicated premix. Type B would be our medicated base mixes, so they're more dilute with a more substantial quantity of feed, but still need to be further diluted to be fed. And then our type C is our complete feed that actually goes into the feeders. And so in the case, with producer mixing their own feed, if they're using Category 2 type A medicated articles to produce type C feed, they will need to have a medicated feed mill license. So when they're exempt from that license is if you're using Category 2 type B or C products to make complete feed, there's no medicated license required. Additionally, if you're using any of the Category 1 products, a license is not required. And so just to step through this a little bit, so for example, let's say we have Palmitil 90, which is a Category 2 type A product. Producers using that to make complete feed, a medicated feed mill license is required. On the other hand, if they're using Palmitil 18, which is a Category 2 type B product to make complete feed, medicated feed mill license is not required. So recommend working with your feed mill, your veterinarian, your nutritionist to determine what products that you're using to make medicated feed, and if possible, utilize type B products to make that medicated feed, because in the event that a medicated feed mill license is needed, that will invoke a pre-feed mill screening. And so I think it'd be advantageous to use those type B products if available. And so next, so let's say a producer mills their own feed. Do they need to have a VFD in order to purchase that medicated product? And so it depends on if the producer is also considered a distributor or not. And so if the producer is not a distributor, then they need to have a VFD in place in order to purchase that medicated product. However, if the producer is a distributor, then they can utilize a VFD, or what is known as an acknowledgement letter, to obtain that medicated product. And so the FDA considers a distributor to be any person who distributes a medicated feed that contains a VFD drug to another person. And in this context, a person can be an individual, a partnership, a company, an association. And so, for example, let's say a producer delivers feed to other sites, but the producer physically owns those other production sites. So in that case, the producer is not considered to be a distributor. However, if the producer has contract sites that the sites are physically owned by another party, in that case, the producer is considered to be a distributor. And so with being a distributor, there's some responsibilities. And so one of those is filing a one-time distributor notification letter to the FDA. Additionally, if there's any change in the ownership or the business name or address, the distributor needs to notify the FDA within 30 days of those changes. There's some additional requirements if you're a distributor as well. So again, discuss with your veterinarian, your nutritionist, your feed mill to determine if you are a distributor and what actions need to be taken. And so I'll mention the acknowledgement letter a little bit. And so basically what that is, it's a written communication between distributors that allows distributors to transfer VFD product between distributors. And so if a producer was considered to be a distributor, they could obtain VFD medicated products through this acknowledgement letter. However, it's important to note that any time we are actually delivering that VFD feed to pigs, we still need to have a VFD in place. And so finally, what can producers do to prepare? At the end of the day, it's all going to boil down to thorough and effective communication between all parties involved, between the producer, the veterinarian, and the feed distributors and the feed mills. And so if you're a producer, ensure that you have good working relationships in place with all of these parties. Discuss with your veterinarian your current herd health protocols, review those strategies, discuss what needs to be done in order to become compliant with these new changes by January 1st. And so one of those things that can be helpful from what our group, working with our producers in order to get them ready, is that when you're getting ready to have these discussions with your veterinarian and your feed mill, it's helpful to have a list of the diets that are utilized on your site or in your system and what drugs they contain, so we can determine if a VFD will be required for them. Additionally, it's also helpful if you have a list of your sites and what feed mills feed those sites and maybe the associated flows for those sites as well, so that the exact structure and number of VFDs can be determined. And so finally, antibiotic use, it's definitely not going away, but it is changing. And so we're well on our countdown to January 1st next year. And so at that point, all VFD feed that will be fed or is currently being fed will need to have a VFD in place. And as I mentioned, communication between all parties involved is going to be vital for a smooth transition period. And we're at the point where, preparation at this time to get ready for those changes will help prevent a delay or a gap in any medicated treatment for pigs.